Give me just 1 second, Deputy Mayor.
I think we want somebody to speak as well.
Deputy Mayor, we are good to start the meeting.
Is it going?
Correct, you can start the meeting.
Okay, I would like to bring the Joint Animal Services Commission meeting of August 2nd to order. And before we have a motion on the agenda, I would like to add 2 agenda items. So one is just an update on the 14th Street in Lacey, the cat situation. And the second one is just a brief thing about the online licensing requirements. And with that, may I get a motion?
Where are those gonna be put into the-
Well, I would suggest we,
Would you like to do those at the end?
put it at the end, or maybe staff presentation reports. We can put one more item under that about the update to the 14th Street, and then the other one at the end under discussion items. Is that okay with everyone?
Yes, I
Yes.
move approval.
I'll second.
Discussions.
It's been moved and seconded to approve the amended agenda. All those in favor say aye. Aye. All those opposed? Motion carried. Thank you. So with that, I think, oh, we need to approve the consent agenda now for July 19th.
So moved.
Second.
Moved and seconded to approve the consent agenda. All those in favor say aye.
Aye.
All those opposed? Motion carried. So it's public comment. Is there someone online that would like to comment?
Deputy Mayor, it looks like we have 2 members online.
Okay,
We're promoting Robert Frugelman.
okay, Robert. So please keep your comments to 3 minutes and state your name and where you're from. Thank you. This is Robert, right? Yes.
And Robert has dropped off of the meeting. We have 1 more, it's a phone number.
Okay, and that might be, please state your name and where you're from and keep your comments to 3 minutes. And this might be, shoot, who was that? Thought I had it here.
So if you are calling into today's Joint Animal Service Commission meeting, you should be able to unmute yourself and talk to the commission.
I don't have the name available right now. Can you unmute yourself, please, and state your name?
How do you do it on phone? On phone, it's different to unmute.
Oh, it is. It's sort of like
It's like
star
Star 9.
9. With, I don't hear anything more. There's just the one on the online at the moment.
Correct.
It looks
Um,
like Robert rejoined.
Nope.
Okay, Robert, please.
I don't have a comment.
Oh, okay. So would the person that's on the phone, do *9, and if you would like to comment, otherwise say you do not want to comment. Hearing nothing, I assume that they are just watching the meeting, so we'll go on. If I hear otherwise, they need to let me know through just by saying *9 and say you would like to comment. But with that, we're going to move on.
We skipped the director's report approval. It was after the consent agenda.
It technically
So
is.
that was
it's
approved
in
the consent agenda?
It's in the consent agenda. Yes.
It's in the consent agenda, yes. Okay, so next up is the approval of the director's report.
We approved it with the consent agenda, unless you guys want to.
Oh,
pull it
that's
out.
still, oh, that's still a part of that.
There's-
Yes,
there's a
I'm
couple-
sorry.
There's a couple places with grammar you're using. You're using plural when you should use singular, or singular when you should use plural,
Thank you, Doug.
a couple places.
Okay, so we're now past public comment, but we're at staff presentations and reports. And so would you like to start with the volunteer program updates?
Yes. Hi, Chandra.
Hello.
Chandra Mincher, our volunteer and outreach coordinator, is joining us today to give an update on the volunteer program, as well as to explain the results in our of our survey. Shannon, hold on one sec, Chandra.
I'm sorry to do this. Can we go back to the public comment? It is actually *6 to unmute.
Oh, I'm sorry. Yes, yes. Please, Chandra, if you don't mind holding off. For the person that's on the phone, do *6. Are you able to do *6? Oh, yes,
there we
they
go.
took it off, so, okay.
They're not,
Oh, no, did they drop out?
Yeah.
They dropped out.
Yeah.
Okay. If they come back on and are able to speak, would you keep a look for that? Okay,
Absolutely.
so Chandra, please go now.
Hi, I'm Chandra. I'm the Education and Volunteer Coordinator. I started as a volunteer at Animal Services in January of 2006. At that time, there had been no volunteer coordinator for over a year, and I was hired into the position in December of that year. So I've been very fortunate to see Animal Services volunteer program as both a volunteer and a coordinator. You guys have in your packet a copy of the Volunteer Program Assessment, or VPA. This is something that groups do across the country, and so we were able to apply early this year. I believe it was around February or March, and we were cleared to take it in May, and so we did it in June. We already had changes and updates we were planning on the program, but we wanted to take this assessment. We thought it was a great time to see if where we thought we needed to go was in line with what the volunteers wanted as well. And it looks like most of those things did link up, which was wonderful. We were very happy with the results, not only because those weaknesses were the ones we knew of and were working to address, but also because it showed how satisfied the volunteers were with our programs. I'm not going to go into all the details of the numbers, but just to give you a quick overview, anything that is unfavorable was marked from a strongly disagree or a disagree. Neutral was neither agree nor disagree, and favorable were the agrees and strongly agrees. And the norms were the average of the favorable percentage from across all the different groups that took the VPA, not just ours or not just an animal shelter. The VPA is more designed for the shelter volunteer program than a foster results because that's very remote and separate, but we wanted to see how each group felt. So we did 2 separate polls for each group. For the fosters, under the results, we summarized the weaknesses that they came up with. The foster software was confusing, which I agree it has been. The staff are very busy and that has delayed some communications. Yes, that part of that also tied into some COVID responses, but definitely was an issue. And that the volunteers would like more training for the foster homes. The strengths were the foster coordinator. Yay. The staff really care for the animals, and that shows to all of the foster homes who participate, and that we have good communication with them. So those were excellent results. For the volunteers, so those are the people who volunteer at the shelter. The weaknesses of the program, the most common responses were all due to COVID restrictions and what they could and couldn't do in their interactions that were limited. Lack of communication between volunteers was mentioned. It wasn't clear that that wasn't a COVID response, so we included it in the summary, but it most likely was based on their saying, but not definite. And the second most common response of a weakness was just the overall age, size, and condition of the building. Strengths of the volunteer program would be the volunteer coordinator, the level of communication they receive, the training they receive, and the flexibility of the program. If anybody's not aware, our volunteers get to pick their shifts. They are not put into a set shift each week with a couple of different exceptions. This allows people who have ongoing family dynamics they need to work with, people who are on work on call, to be able to volunteer, where at other agencies they may not be able to because they couldn't give 100% commitment to come in each week at the same time. As we move forward and look at the steps for improvement, the biggest one that we were planning on was new software. We started to do research. It wasn't enough for us to change the shelter software. We decided to do the volunteer one as well. Originally, the plan was to implement that next year, but we found an excellent solution that was only $5 more a month than we're currently paying for and does a whole lot more. So we decided to go ahead and roll that out, which is what I've been working on for the past month or so. This will make it a lot easier for the foster homes to be able to check out their animals, since that has been very confusing for many of them. It has community chat options so that the volunteers will be able to talk amongst themselves if they choose, but that's not a requirement. So both of those address issues that they brought up as weaknesses. It'll put all of our educational resources under one roof. Right now, everything's divided between several different platforms. So this new software will bring it all together under one roof. So that should make it a lot easier for them to find it, also addressing one of their concerns. The online learning modules that this provides will allow me over time to provide ongoing education options for them where they don't have to necessarily do it in person, but they can have that at their fingertips whenever they want at home. And it will also, at least once it's up and running, lower the administrative time it takes to do several of the tasks that are in my day-to-day work. So this will allow me to have more time to help the volunteers in foster homes. So a lot of the weaknesses in the program, having some new updated software will help address those, which is great. We were also planning on doing a volunteer feedback box. We're going to do an online version so they can fill it out whenever they want. They can ask questions, they can suggest changes. And one of the things that is important to me is to also give them the opportunity to then be part of the solution. So we ask if they would like to participate in implementing some of the changes that they want. Another advantage of the software, not necessarily related to the survey, but just the new software, is that it will allow for online orientations and trainings, which will help streamline the onboarding process, making it easier for people to get in and volunteer, and allow for much better accessibility to the public in general to become part of our program, both volunteering at the shelter and as foster homes. I am currently onboarding the foster homes who are already in our system are being onboarded to this new software. Next will be the shelter volunteers will be onboarded. That will be followed by bringing in new foster homes as well as new shelter volunteers. For both of the two groups who are coming later who are not currently part of our program, we have an online list where they can sign up to be notified as soon as those programs are able. Because this new system lets us do so much more at the same time, it's not just a simple matter of, oh, we just move everything to the new system and go. We get to create online applications, online orientation. So there's a bunch of steps, but in the long run, I think it's going to be of a huge benefit to everybody. We also have our first event in quite a while, which is coming up later this month on Sunday, August 15th. It is National Check the Chip Day, and that would be as in a microchip. And so from 1 to 4 p.m. at the shelter, people can drive on up. Myself, as well as a few volunteers, will be there. We'll run out to the vehicle. We'll give them a scanner where they can scan their pets that they bring, see if they have a microchip, make sure the microchip number is still where they think it is and running. We'll have information to write down for them if they do have a chip of where to register it, as well as a link to the online licensing portal so they can make sure their pets are licensed and include that microchip number into our system. So that's what we have currently on our plate. Do you have any questions?
I have a quick question. Could you repeat the date for the drive up microchip?
Absolutely. That is Sunday, August 15th from 1 to 4 p.m. And we'll be putting information on the Shelter's Facebook page later this week after the staff meeting on Wednesday, because before I announced it to the public, I thought all the staff should know what they may be getting phone calls about with any questions.
Very good. Thank you.
Is there any other questions?
I have one. I'm looking at the assessment summary.
Uh-huh.
And the items is perception of voice. What is that? Because that's the one we seem to be getting the lowest.
Oh, that's the one. Thank you. I skipped that. Thank you for bringing that up. A lot of that is them and seeing if they feel their voice is heard, where the majority fell in the neutral system. So one of the suggestions from that was to have some volunteer meetings once a quarter, once a month, depending on the need, where people could get together, be able to ask questions, see what's going on. We've tried them in the past. They have not been successful, but maybe with the new world of Zoom and Teams and other online options, it would be something that they may be more interested in joining in and getting their voices heard, as well as that suggestion box will also be an option for them.
Thank you.
Thank you. That was actually my question too, so thank you. Are there any additional questions? Seeing none, thank you so much, Chandra.
Thank you. You all have a beautiful evening.
Thank you. So next up is shelter statistics.
Hello, everyone. How are you doing this evening? All righty. So as you know, we switched to Pet Point in April, and come with that switch is some changes to how we are able to pull statistics out of Pet Point. So I've made some adjustments to the Excel spreadsheet that you guys get for the shelter stats. And so we're going to go through that real briefly so you guys can see where those changes are made. So if you start looking at April, May, or June, you'll notice that the incoming animal section of the spreadsheets is exactly the same as the previous spreadsheet in terms of how the data is displayed. Pet points, just like multi-ops, total animals in, custody, miscellaneous, strays received, all that stuff is the same. The changes that I've made here versus the old spreadsheet is I have current month versus previous month, or excuse me, current month versus last year, year to date versus last year's year to date as well. As you scroll down, you'll see wildlife handled. That section again is exactly the same as the data that is shown previously, and that data is pulled the same as it is in multi-ops. And outgoing animals is also shown the same as it was when we were pulling it out of multi-ops. The big changes between pet point and multi-ops is how euthanasias are categorized. So in multi-ops, we used to categorize euthanasias as E1, E1N, E2, E3, E4, and E6, and they all had kind of specific things that are attached to them. In in pet point categorizes euthanasias into 4 categories. The first category is unhealthy, untreatable. So these are animals that are coming in that either have a medical or behavior issue that the shelter cannot treat. And so those would fall into this category. The next category is treatable or rehabilitatable. So these are animals that come in with a medical or behavior issue that we can treat and can fix. The next category is treatable, manageable. These are animals coming into the shelter that have a medical or behavior issue that we cannot fix, but we can manage. And then the last category is healthy. And so every animal that comes in will be designated one of these categories at time of intake. Those categories can change as information or treatment of that animal changes. So an animal may come in as treatable, rehabilitatable. We treat it, it is now healthy, and that at time of outcome would become healthy. This is for any kind of outcome. It may come in as what we think is healthy and then display some kind of medical or behavior that we did not see. And then that could change it to either manageable, unhealthy, untreatable, or rehabilitatable, depending on what that is. And so in this category, all euthanasias for, let's say, the month of April are in one of those 4 categories, giving us a total of 31 euthanasias for April. And then right under that is, of the 31, 17 of those were owner requested. So we pull those out there. And then you'll see died at shelter, escaped, and stolen. Those are exactly the same as from multi-ops. And then lastly, filled and other services. The only change to this section is we've added Yelm as that Yelm contract started in April. So April, May, and June will all look similar to what you're seeing here. Moving forward in next year, you will have tabs like this for every single month, and then there will be a summary sheet as all of those data points will transition from month to month, and you'll be able to categorize. You'll be able to look at things basically orange to orange versus now where you have that big section that just does not compute or is not the same as previous years. Questions on how this is displayed?
I've got a couple. It would be nice if you would make the page break at a spot where we're changing what we're looking at.
Okay.
To put the euthanasia died, escaped, stolen at the top of a page, instead of breaking that section into different places. Same thing with the first one. The top of the second page is the total from everything on the first page. And so it's tough to see where they're doing. And so when I'm trying to take this information and put it into my table, it became a little bit more difficult.
Sure.
But I did find what I was trying to find. But my other question is on the euthanasia. I'm looking at the numbers so these 4 categories, the unhealthy, untreatable, treatable, rehabilitatable, those 4 categories, it looks like you total 50. You have a subtotal of 50 in that. And then you have a total euthanasia of 50. But within that, there are 28 owner requests. So are the owner requests folded up into those other numbers?
Yes, they are.
4 categories?
Yes. So you would essentially subtract the 28 from the 50 to get how many were not owner requested.
So that's why we're getting 13 dogs in June. And there are 5 cats in June in the treatable rehabilitatable. Those 5 could have been owner requested.
Possibly, yes. I would have to dig into each individual data.
Again,
point to
2
find
healthy
out
dogs being euthanized. So I'm wondering.
Yeah, that was confusing too.
Yeah.
So what the reporting categories are referred to as the Asilomar Accords. The Asilomar Accords were established back in early 2000 as a way to identify animals in different categories. Now, that doesn't necessarily mean, like Andrew said, that some of these would end up one way or another. There's a couple of things that could have happened with the healthy dogs. One, as the staff is learning new software, somebody could have forgotten to transpose that over. It could also very much be an owner requested euthanasia, and in essence, could still be a healthy dog, but if that dog did something, they're still technically healthy upon intake, because it's an owner requested euthanasia. So it could be a couple of things. Like I said, the staff could have forgotten to move them over in that category, or we very well could have had an owner requested euthanasia of a dog that would be deemed healthy. When they're owner requested, we do our best to give them other resources when we feel that they are adoptable, including allowing us to adopt the animal out, but they do belong to the owner, and at the end of the day, it is the owner that gets to make that decision. And so keep that in mind as well. The way this report tallies as well is it is the shelter animals count and the Asilomar Accords data, and so they do pull out the owner requested euthanasia. So that's why you see total euthanasia is 50, because its total shelter euthanasia was 50. They don't count those 28 owner requested euthanasias as part of our overall total. And so just a slight differentiation on your school of thought, if you look at what's called a live release rate, the live release rate does not calculate owner requested euthanasias. If you're looking at what's called a save rate does, because they look at heartbeats in and the heartbeats out. And it's really just two different schools of thought from how that's interpreted. And so that is why that's pulled out. But, depending on how we want to report out, if we want to look at a save rate, then those totals would be included in that. So a total euthanasia could be 78 animals total if you're including owner requested euthanasias.
Sarah, the 50 has the 28 included.
Does it?
Yes, it does.
All right.
So the 50 is the total euthanasias for the shelter for the month of June. The 28 is of the 50, 28 of those were owner requested euthanasia.
Fine, thank you.
Okay.
That makes more sense. I thought it was not counting that. That makes sense.
No,
Yeah, and if we want to make this a
just-
little bit easier, so one of the reasons why it's pulled out like that, and you see subtotal and then total, is because we are categorizing them differently. And I wanted to show last year versus, I want to show kind of multi-ops piece for last year and this year and things like that. And so that line that says total euthanasia lets you see the total euthanasias for our shelter this year of April, or for June, for last June, year to date, and last year to date. I can change this a little bit to put it all on the subtotal line and just have that as total euthanasia, and then right under it owner request, and not have that total euthanasia, that second total euthanasia line, if that's a little bit easier for everybody to read. This will be less confusing once we get past the transition year, because again, data will be easier to report because it will be all the same month over month.
And you don't have data for last year or year to date.
We only have the
It's not showing up here.
You should
Yeah.
only have the totals, because
Yeah,
the
totally.
categories are different. The
Yeah,
categories don't match. So that's why you'll see those blacked out boxes, because the categories from the previous year are different.
we
And
had
so
owner,
we can't,
we had owner requests previous years.
Well, here's the question. How do you go back through like a 5-year analysis if they're two different sets of data to try to look at, or can you even? Or do we start just from this year to start analyzing a 5-year trend? Because we can't go back because the data is different. Is that correct? Or
For the
not?
most part, we can look at total euthanasias for a 5-year trend. But we can't look back 5 years for specific categories because we had to change them because Pet Point does not allow us to do them the same as we would be doing them in multi-ops.
I'm tracking total euthanasias and euthanasias minus owner requests. I'm tracking owner requests, so I have that information for 21 years.
Right, but what I was saying,
But it's the same, I can use the same data here to fill in the spots. I just needed to understand what it was. And so I was adding double adding. And what I filled in the last 3 months, which is when I got this latest
oh,
information. So
okay.
when I filled in the last 2 months, I was double adding on the euthanasias. So I just had to go back into my spreadsheet and I can take it out. And we would have the subtotal. I have the subtotal of those four, and I have these order request ones. So I've got that. I just don't have these 4 categories. And so we're starting brand new with these 4 categories. And we won't be able to track those, but we can track totals.
Okay.
And then,
Just the categories for euthanasia
Yeah.
only made things wonky. The total numbers are still there and Doug still has all the numbers, like it just, the way it gets referenced will not be comparing apples to apples because we're having to categorize them differently.
Okay.
there's still euthanasias.
Caroline, do you have any other questions or anything?
No, I do appreciate the conversation though, because it's things I don't really think about when it comes to this. So I appreciate Doug's and your input.
And we will get a similar form to with all the whole year at a time.
Yeah, so we will be doing a summary sheet. So you'll have each individual month tab at the bottom and then a summary sheet tab, or if you guys are printing them, a summary sheet printed that shows all of the months in one table.
I sent you guys the whole Excel spreadsheet, so it shows
Yes, I kind of.
all the way through March and then the transition to April.
But then I'm assuming the data from those new tabs, the April, May, June data is going to get put into the summary sheet. It wasn't.
So Michael, do you have any additional questions or anything?
I don't think so, no. It just sort of seems like, this is a different format because we have the new software system. We're, gonna have to make it jive with what we've been doing. So,
Okay,
That's real close.
yeah.
so with that, thank you. I think we can move on unless somebody has a last minute thing here. And then we have one more update that I would like to just talk a bit briefly about it.
So the cats on 14th Way, we've had this conversation before. There is some concerns with one individual who does not like the cat colony in that area. There are quite a number of cats. We have been working there over the last year to trap. When they are able to be adopted, we do so. When we can send them to rescue, we do so. And other ones that are true feral cats are being spayed and neutered and returned to the area. We have been working with other members of that particular community. Everybody is willing to pitch in. It's also not just us. There's other organizations involved as well, such as Feisty Felines, which is a trap, neuter, return organization that specifically focuses on trap, neutering, and returning feral cats to the area. They are not owned by a particular individual. They are community cats in its essence. So we've already pulled 11 cats. One neighbor has already trapped and returned 15 cats. So we are working on the situation. We just unfortunately have one person who's not satisfied with what we have been doing over the last year. And a colony that size does take time.
So are there, obviously not kittens, but yearling very young of year pregnant ones too.
I'm
Yeah.
sure there are, because cats can start reproducing at 5 months.
Um, And then I guess the issue is, are they, from what she said is that they're so in bad health, are they still adoptable?
It depends on the level of health. It depends on what they have.
So what we have seen come in has not been unhealthy in terms of medical health. What we have seen come in that we have been unable to adopt out are feral. So
Feral.
most of what I want to say has come in has been healthy enough to where we would spay, neuter, and release it and not have a problem with that. But yeah, we have not seen actually unhealthy cats that I am aware of the 11 that we've taken in that we've had to euthanize for medical reasons.
Okay. And I would also say, you know, out of concern, I think a lot of people view, I think our general perception of what is healthy is in terms of cats are actually slightly overweight. And dogs, I mean, to be like, let's be completely honest, like we see ribs and we think that they're unhealthy, but a true definition of like where an animal is on the scale of their weight, you should actually see muscle definition and use slight definition to ribs. It's when you start seeing things like hip bones and other places that I would be concerned. But we do frequent drive-bys. We drive by at least every couple of weeks just to check on everything. We cannot trap right now because we are at capacity with cats and we do not have the space. Feisty Felines has had to pull back trapping because there are no spay-neuter appointments. She went from having 100 spay-neuter appointments a month to 10. So this is another example from when we talked about at our retreat about the veterinary community starting to affect what we can do because of their lack of staffing. It starts to impact other services such as this. So even if we wanted to, we cannot trap, neuter, return at the moment. But we have told them that we will come back in the fall and begin trapping again, or at least once our capacity is lower. And we're already working with other community members. They are calling us when they set traps to make sure that we have space before they do. And then they're making appointments to bring these cats in. So we are working with other members of the community.
So how many people are involved that's within the neighborhood, you know?
I don't have an exact count. I know there is at least 2 to 3 other neighbors, if not more. And I know a lot of people are taking care of it on their own as well because they just want to make sure that the cats are spayed, neutered, and vaccinated and cannot be reproducing.
Okay,
And so we're trying to support that as much as possible, including care in place kits, which would be if they do manage to pull a mom with babies, we can give them supplies just like they were a foster. And when they are old enough, we can adopt them out.
okay, sounds good. Are there any other questions? I mean, this is not my street, but I live on 21st, so this is a close problem. Is there any other questions about it at all?
Can I ask a brief question? So the policy behind trap, neuter, release is that if you were to just remove the cats, that a new cat living outside would just occupy the space that that previous cat had in terms of territory because they're territorial animals. So we trap them, neuter them, and then bring them back to their territory where they were. And since they're neutered, eventually those cats will eventually, you know, die of old age, being happy outside cats or whatever. But wouldn't another new cat then just take the place? Like how does it, is this like a recipe for controlling the population in the most humane way, or is it a recipe for like ending the occupation of this particular area with a bunch of cats? Like, what's the goal for us to be able through TNR for like, how do we explain to people on 14th Way what we're trying to do with TNR?
Michael, I'd say it's a combination of two things. So yes, one of the things that you stipulated is true, that if you remove a cat from the colony, other cats will move in. What you're supposed to do as a community is, as cats are dying off, is you're supposed to reduce the food sources, because there are people in that area that are feeding these cats. Even if it's the people that we know or not, we've talked to the ones that are dealing with us to stop feeding, and they have stopped feeding in their area. But if the food supply stays at the level that it is, as cats die off, then other cats have the ability to come in. But as cats are dying off, if we lower the food source and the trappers and community caretakers are lowering that food source, then the cats will not move in. Statistics show that if you just remove cats and you euthanize them, it doesn't take care of the problem. And so the only thing that has actually kind of helped is the TNR programs that have stopped the communities from growing, and working with the people in the area to understand that the only way for these cats to slowly dissipate is to pay attention and to stop feeding, and slowly stop feeding as you start seeing cats no longer in the area.
Okay.
Got it. That's helpful. Thank you for the explanation. It's just sort of helpful to hear that clearly articulated, so that when we get questions about the policy and the program, then we can say, well, this is what we're trying to do with it in the community and how we're trying to address the problem. So thank you.
Okay, thank you. So with that, let's move on to the next item, which is discussion items, recruitment for JASCOM appointed positions. And there was an attachment with that.
Yes, so with Dr. Ripka retiring from her position, she decided to step down after 10 years. It leaves two spots open, because if you remember when we revisited the intergovernmental agreement, we added the option of a secondary position. I shouldn't say secondary, it should be a 7th position. And so with that means that we technically have 2 open positions right now, and it's been 10 years since we've had to appoint one of these positions. And so moving forward, I do have some recommendations on how we should proceed, but this is a discussion at the moment because I would like input from you as members of how we would like to appoint these positions. So my recommendation moving forward would be that we actually solicit and put it out there like Lacey did for several of their new commissions that they've just had, and request that people submit a letter of interest as to why they would like to join. Also some qualifications, whether that's a resume, a CV, how that goes, and then have all of them come to Joint Animal Services for us to do an initial review and then be able to recommend to JASCOM top 2 or 3 candidates for you guys to interview and look at, and then would vote on the appointed positions.
Okay, so.
But I was curious from Doug's point of view, since he has the longest historical memory. I did not know how we did it in the past. I thought this would be a good opportunity to revisit it, but I wasn't sure what our protocols were in the past either.
There was, I've been on for 20 some years, so the only new, other than the city council and the county commissioners, the only replacement that I experienced was the latest. And she was appointed by the vets in the area, as far as I could tell. That they took on themselves to say, we need to have a representative, and so who wants to do it?
Well,
Yeah, it wasn't the commissioners. The commission did not have any input on who that was.
Oh, interesting.
So there was no application form, there's no process of vetting who that person might be. It was a representative of the veterinary community.
I mean, would we need to vet them? Is if it's recommended by, and it's someone who's sending in the representative, why would we need to vet them?
I guess if we have multiple applicants who would like, not knowing what the previous history was on how that happened, the idea would be that we would actually go to the Washington State Veterinary Association and ask for a list of veterinarians in Thurston County and let them know that there is a position available for who would want to join us.
Don't they have a listserv? Isn't this something that could be sent through the listserv and just say there's a position open for this instead of, us having to get that list? And
It depends how open that list is to the public.
You also have to
Honestly.
break it down to Thurston County.
Yeah, so I would much rather that they do
Veterinarians.
that.
So one of the things that we could do is kind of a hybrid, is ask for their 2 or 3 or 5 recommendations. And then we look at those and choose one. Rather than have them submit necessarily, but they would still, I would think, need to have some kind of a CV or something so that we could look at it. What do you think, Michael? I don't want to keep forgetting you there.
I don't really feel super passionate about us being super involved in who gets selected. I don't know, I'm pretty deferential to whatever the body decides is appropriate. It makes sense to me that we would ask the local veterinary community for recommendations and they can see who they want, and then, yeah, I don't know. I don't feel super strongly either way.
Okay,
All the other positions are determined by who they're representing. So the cities are all pick the person, Humane Society pick the person, so.
that's true.
Why make this one different?
So do you feel that way as well?
yeah,
Okay,
Yeah, they would probably know people, and you certainly want to get people that are interested, and they would probably have a strong feeling of what would be a good fit, maybe.
Lisa knows the people.
yep, and this was part of Lisa's idea, was to solicit.
Oh, okay. Well, the rest of us are ambivalent about it, so although she is a veterinarian, maybe.
She did not come out and say that there was a group to recommend. She said that we should send something out to the veterinarians in the area and have them apply
Then
that way.
Propose themselves, nominate themselves, self-nomination process.
But on the other hand, then we wouldn't know really. None of us except Lisa has expertise in being a veterinarian.
If we're asking them to represent the veterinarians, I would think it would be wise for us to have somebody that the group of veterinarians trust and want to have represent them, as opposed to a veterinarian who comes in and wows the commission, but doesn't know any other people, doesn't know what's going on. I think we'd want to have somebody that has the pulse of the veterinary community. And so to get that, we would need the veterinary community to participate.
Okay,
Yeah,
well then I will start from square one and come back with new recommendations on how we can go about that.
That's the veterinarian side. The other side, another position. I like the idea of going out and asking people to self-nominate.
so Shannon,
Yeah, commissioners, it sounds like what Ms. Hawk is saying is that there might not be a body, one collective body of Thurston County veterinarians to go out and solicit for a candidate for this position. Is that correct, Ms. Hawk?
That's correct.
So her recommendation, and this was based off of her conversations with Dr. Ripka, would be to create something where veterinarians who are interested could self-apply. What this body could do was, again, if they were to choose that self-apply route, is ask if Dr. Ripka would be a part of the review. Again, she is connected to the veterinarian community here in Thurston County. And so that could help expedite that process. Going out to, the veterinarians and asking them to, kind of create and nominate one person or a couple of people for this position puts a lot of work on the group. And it's a group that currently does not exist. So there'd have to be some legwork and coordination on their ends to get that done. And that is why Ms. Hawk is recommending the route in which she suggested tonight.
So they don't have any kind of a type of convention or organization where they get together once a year or 2 years or?
I will double check with Kristen and Lisa, Dr. Ripka and Dr. Parsley. But that is not sounding when I was asking them how we would go about finding Dr. Ripka's replacement. That
Okay.
was not an option that was given.
Okay, well, in that case, we need to rethink about that.
But I will absolutely investigate and make sure for certain that there is not a group that we are unaware of that would do that.
Okay. Okay, but plan B then maybe would be what is being recommended to have them submit. But I do think I could not, I've been in a farm area, that's my extent, everyone, so I've rubbed pigs' little bottoms and stuff, so we definitely need somebody of expertise there, and obviously Lisa is one, but it needs to be somebody that can help be objective about the process, and so obviously Dr. Ripka, but maybe we even could get one more person that would be willing to sit in on it.
Absolutely. And it also, we don't have to do a self-nomination. We could make it a requirement that you have to be nominated by somebody and that they provide veterinary references as well.
We could do that too.
I like the vet references because at least if they're providing local ones, we see that they have a connection with the local community
To the community
here.
And I mean, it could be a requirement that it's at least 3 and they can't be at the clinic that you're working at. Like there's some parameters that you can do. So it would have to be veterinarians from within the community, not just from the clinic you're working at.
At least letter of recommendation or something like that.
Yeah.
Letter of support.
I have another question. Would they have to live and work in Thurston? Because sometimes, they live outside Thurston, but they work, in the area.
I
And
think
sometimes they live in the area, but they work outside. What's the,
I think the requirement was they had to work within Thurston County.
okay.
Okay. Well, did you have directions yet, or are you still confused?
No, I have my marching orders, but you also like the idea of the application process for the nonprofit position, the animal related nonprofit position.
Yeah,
And I feel like once that is ready, passing it to the jurisdictions and each jurisdiction posting it on their, Facebook and social media and.
That was the plan.
yeah.
Was for you guys to.
I jumped ahead, sorry.
No, it's a great idea. And I think we will only get a number of applicants if the jurisdiction shows support by supporting it themselves.
Yeah, I think so too.
And Commissioner, we'd make sure that that application was a central source so that all jurisdictions are working and it's being pooled in one location rather than disparate locations.
So if it's a form application, should it be standardized between all of us?
Yeah, so Commissioner Pratt, it would be a standardized form for any veterinarian in Thurston County, or, the second position that's being created for the vet-related service or animal-related services. It would be one standardized form, and it'd all be the same link that'd be sent out to all the jurisdictions, and then the jurisdictions would disseminate that link on, their websites, their social media, any sort of newsletter, communication outlet that they have. Individuals would then go fill out that form and submit it, and it would all go to one place so that we'd have all of those applications in a single area rather than between all of the 4 entities.
Okay, that sounds good. Is that okay with you, Michael? Okay,
My version of my 2014 version of the IG
Mhm.
says licensed veterinarian residing or practicing veterinary medicine within Thurston County.
Residing
Residing
or-
or practicing.
Okay.
oh, residing too, okay,
Now, I don't know if that got changed in the latest version. I doubt it.
I don't think so. Okay, so we've covered that topic. We don't have a director's report.
That was in the.
Suzanne.
Yeah.
So the other thing briefly, just why I'm asking is, and it's not necessarily meant to be a personal thing, but I just know about it because I don't have animals at home to register online. But when my son I told him to go register his dogs. So when he went to that, he was going to put the chip in because the registration required, not required, but asked that, but it asked for manufacturer of the chip. But when you go and wave that little thing over your dog's or cat's neck, it doesn't require that you plug in the manufacturer. So why is that necessary?
So it's necessary, it's one of the only, it is a requirement for Pet Point for that licensing portal to be a function. But what I will tell you is that your microchip number, the first set, it's like 4 to 6 numbers, is actually telling you who the manufacturer is when you look it up.
Oh, really?
Yeah, so you can, by the start of the numbers, there's a list. And we can provide that resource because it's a widely distributed just flyer. We can add that to the website to help people. But there's just the first couple of numbers is what identifies the microchip company.
Okay, that would be helpful, in my opinion.
I think that's an excellent feedback and I appreciate it because this is stuff that we built it, so we don't necessarily see it on some things. And so it's nice to have other people run through it and give feedback. Now, that doesn't mean that we can change it because there's some things that we just don't have control over what we can change because that's the portal.
Right.
But
if you have a way they can go look at it, that would be great. It's just knowing my son and probably many others, not just him, because he'll say, oh, well, I couldn't do it. Well, I'll call eventually this place and then he'll put it off and then he'll forget it and then he won't. I don't think it's just Brian.
no, and the microchip number isn't a requirement to license because I was able to license my cat without providing his microchip number, even though I have it. And of course, there's going to be a learning period for everybody because this is new for the entire community and we are set up and ready to help walk people through this process.
Okay, sounds good. Because I think it's a wonderful thing to have it online. I really do, but I just needed to ask that question. We're sort of at the end of our agenda. Is there any other questions or anything? And these people never came back on, correct, to talk?
That is correct.
Okay, so with that, Michael, do you have anything?
Yeah, I just have a follow-up question. I was Sarah, could you talk a little bit about the portal coming on? Like, is it working well with staff? Is it? Yeah, I assume it's saving us time and effort by automating some of the processes. Can you just give us a quick 30 seconds or so on like how things are going with it, traffic wise and process wise?
It's going really well. We train the staff. We had Pet Point walk us through the whole thing from start to finish on both ends. So what a community member looks like registering their pet, and the walkthrough on the back end of what we need to do to complete the process. It's been working really well. We can basically batch at the end of, basically it's at the beginning of every morning because it batches at night. And so we process everything the next morning and get everything sent out. So it's been really easy. It's on, you know, one report that we can pull to double check if we need to actually mail out any licenses or if they're just renewing. So it's been pretty easy. We've had a couple of interesting hiccups that we didn't plan for, and they're not hiccups. It just, we didn't anticipate them. So we anticipated people picking the wrong jurisdiction or picking Thurston County because it's cheaper. Apparently what we did not count on is people picking both their city and the county and licensing their pet in both.
Oh.
So I mean, good for them for their extra due diligence. It's an easy refund. So it's, you know, it's not a huge deal, but that was our one that took us by surprise, was that there's been a couple of people who have done their extra due diligence and licensed for both their city and their county. So
Interesting.
good to know on our end too. It just means that we have to make things a little clearer on what they need to select. But again, it's been a really easy process, and the moment it was up, people started using it.
Oh, that's really good.
And so they got a refund, those folks? Great.
Yeah, they got a refund for the county because there's a City of Lacey resident for sure.
Wouldn't you know?
We'll give them the cheaper.
He doesn't live in Lacey, he lives in the Lake.
No, so it's been a really great process. It saved us a lot of time. And it's been a very smooth transition, and Pet Point has been wonderful walking us through the whole thing and making sure that we were supported on that end as well.
How many users do we have so far? Or how many
Oh,
people?
I could get you that information, not today. But I can certainly tell you by next meeting how many people we've had register their pet.
So if you register your pet, you don't put in their chip, can you go back in and put it in later?
You can update your profile at any time.
Oh, that's good to know.
Yep, once you've created your login, I could access my account and my pet's account at any time to update information.
So if it died,
Correct.
okay. Okay. So does anyone else have any other questions?
Our next meeting is on Labor Day.
Yes, thank you, Doug. We will not be having a meeting on Labor Day. Would the following Monday, the second Monday of the month, work for everybody?
Sure, probably. I don't have my thing here. Well, I do.
That, I have a conflict on the 9th. That's, oh, excuse me, I was looking at August. Now, you're talking about September 13th?
September 13th.
13.
Okay, that's fine with me. I do not have a conflict, sorry.
Carolina,
Doesn't look like I do either.
okay.
Yeah, that works for me.
Fantastic. Then tomorrow morning, I will update the calendar for everybody and get it locked in before schedules change.
Great. Okay, so with that, we are officially at the end of our agenda, so I am going to adjourn the meeting. Have a good evening, everyone. And see you next time.
You got some time, Michael?
Yeah,